Hi guys, so I did my presentation on West Nile virus. West Nile virus exists in our society because there are currently no vaccines to prevent it in humans, and there are no medications to cure those who are already infected. There is a vaccine available for horses, but this does not do anything to reduce the spread because they're a dead-end host, which means they can't pass the disease on, unlike birds. This virus quickly spreads through mosquito bites, and as you can see in the picture, infected birds can pass it on to non-infected mosquitoes. So mosquitoes will bite and infect birds, and then those infected birds will infect more mosquitoes, and it just goes in a circle. Because birds are migratory, they cover a lot of distance and they can carry the disease pretty far. Most people who have this disease will not feel sick. Only about 1 in 5 will get a fever and other mild symptoms. About 1 in 150 will develop a serious and sometimes fatal illness. So like I said, it is a mosquito-borne illness and starts with them and quickly spreads to birds and humans. While rare, it can also spread from mother to baby during pregnancy, breastfeeding, or birth, and infected birds are usually the main cause of outbreak. So West Nile virus originated in Africa. It was first discovered in the West Nile district of Uganda in 1937. From there, it quickly spread to Asia, the Middle East, Europe, and eventually to the United States in 1999. It is suspected that the import of exotic birds is what brought the virus overseas to the United States. Risks for the future are that if the proper preventative measures are not kept up, it will be increasingly hard to contain, and the virus will spread rapidly. So educating people on how to avoid bites and using DEET are important strategies we must continue to use, otherwise more and more of the disease will be passed on. Etiological factors are those that are more at risk, so people over the age of 60, those who have compromised immune systems, like those who have cancer, diabetes, hypertension, or kidney disease, and also people who spend a lot of time outdoors, and those who live where West Nile virus is prevalent, because they will have a greater chance of being exposed. So these strategies are mostly preventative, because there isn't much that we can directly do about this problem. Strategy 1 is prevention through encouraging the widespread use of insect repellent and educating the public on how to avoid being bitten by mosquitoes. The main recommendations to avoid West Nile virus are to stay indoors during hot weather, wearing long sleeves, and making sure that window and door screens aren't broken or have any holes, and using insect repellent with DEET. Strategy 2 is a bit more direct: larvicide and adulticide of mosquitoes. This strategy is only used when absolutely necessary because the chemicals that kill the mosquitoes can also harm the surrounding environment. Examples. Example 1 is after an outbreak of West Nile virus in Canada, researchers decided to figure out the best way to prevent the disease. They did some studies and found that window screen integrity, light-colored and long clothing, eliminating paradomestic larval sites, which means clearing out any sources of water in your backyard so they can't lay eggs, and reducing outdoor activities were among the most effective ways to reduce and prevent West Nile virus at an individual level. On a regional level, the most effective strategy was larvicide, and they successfully implemented this in areas most at risk. Example 2 was similar. In the United States in 1999, there were many studies done off surveillance in order to discover which species was most responsible for the rapid spread of the virus. Once they knew which ones, there was a large-scale adulticiding response, and this did successfully decrease the incidences of the virus in those areas. So studies have shown that larvicide is one of the most effective interventions in order to prevent West Nile virus. The continuation of surveillance by public health agencies is critically important to reduce cases globally and domestically. This is important because we need to know how the virus is behaving and where it goes in order to further prevent the spread of disease. Right now, scientists are working on vaccines for humans. They are currently undergoing clinical trials, and that will hopefully be able to end the disease or at least drastically reduce the amount of cases. My opinion. So I believe it is very important we keep funding and researching medicines and vaccines so we can eventually eradicate West Nile virus. In order to reduce the current hotspots of the disease, we should focus on reducing mosquitoes from these environments using larvicide as necessary, along with keeping the public educated on how to avoid being bitten. The continuation of surveillance is important because it allows us to predict where these hotspots will be and where we should focus our efforts the most. and these are my references. Thank you for listening.